Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could join us today. With all things once again related to our hearts, there are a lot of broken hearts that actually need to be fixed. Our guest today is Ajay Kirtane, an interventional cardiologist and endovascular specialist, and he's joining us today to discuss some available treatments and some alternatives to open heart surgery. And I'll let Dr. Kirtane tell you all about himself. Welcome to the program, Doctor.
Well, I really appreciate being here. I'm an interventional cardiologist. That means I do minimally invasive procedures, but I also see patients in the outpatient setting. And as a cardiologist, you get a lot of phone calls from family, friends, and otherwise because heart disease is so prevalent. And the reality is this is Heart Month, and so it's just a time to increase awareness of heart disease, the potential downstream bad effects from a heart attack or otherwise, and how we can actually educate to prevent people from having heart attacks in the first place.
Well, so what are some of the available treatments? Maybe briefly one that you frequently perform.
I think the key thing, first treatment, is to start early in the chain, and if you recognize symptoms of a heart attack, you got to seek medical attention immediately. Call 911 and activate the healthcare system to work on your behalf. But once patients come in with heart attacks or chest pain symptoms, we typically take them to a place called the Cardiac Catheterization Laboratory or Suite, where we do minimally invasive procedures to open up arteries that are blocked that are causing the damage to the heart.
So when we're talking minimally invasive, how minimally invasive? Are we not talking incisions at all or minimal incisions?
Yeah, so no incisions, no holes. What we aim to do nowadays especially is similar to how you have an intravenous line or an IV placed. Mm-hmm. We would go in and isolate just the artery in the wrist and basically access it, get in through the wrist, and we actually can go into the heart and do all our work through a minimally invasive, basically IV in the wrist. And once it's done, patients can sit up, move around. It's not like the old days where you have to do open heart surgery for these problems.
So when you're in the wrist, in this artery, how are you seeing inside?
It's amazing technology that's been developed over many years, but essentially on a screen, we're looking at an X-ray. And so the X-ray allows us to steer our very fine wires, very soft wires to get from the wrist all the way into the heart and into the heart arteries themselves. And once we open the artery, we can actually deliver or advance a stent into the area of interest to open up that heart artery, restore blood flow back to the muscle, and then we take everything out. And there's only a small, like a Band-Aid on the wrist once that's healed over the course of a couple hours.
Now, you mentioned that once this procedure is complete, the patient can sit up, walk around, and they're able to go home and, I guess, resume at least some semblance of a normal life, or can they progress to doing whatever they were doing before the heart problem in the first place?
And I think here's where it's really important for the early activation of the medical system to take place, because if this is done early, that's the situation where we can save the most amount of heart. If somebody's been having symptoms for a long period of time, then the amount that we can save is less. And so provided that the patient comes very rapidly to the hospital and to the emergency room and then to the catheterization lab, we expect full level of functioning for most patients after they undergo an exercise program and rehabilitation. It's pretty amazing, actually.
As the leading cause of death of both men and women here in the United States, heart disease, how cost effective is some of this new technology? I mean, it sounds very, very exciting, but is it something that all of us can look forward to getting the benefits of if necessary?
Well, unfortunately, it's something where with good preventative medicines, most of us don't have to look forward to it. But if it does occur to us, then it's something that, especially for heart attacks or patients with severe symptoms, it actually can be very cost effective, and in cases of heart attacks, prolong patients' life and their quality of life. So I think that it's one of those elements of medical care that we know can be underused, and in fact, if used in the right patients, is of benefit not only to the patient but also to the system. But then there are also some specific attributes of the procedure that have advanced more recently. And it's interesting to talk about those, too, to try to make the procedure safer, more effective, and more precise.
And what would at least one of those advances be that you see?
I think in the old days, what we would do is we would just look at the X-ray imaging and rely upon those pictures alone to guide our treatment. And there have been numerous advances in what we call imaging technologies, or ways to actually look within the blood vessel itself with either light-based technologies called optical coherence tomography or ultrasound-based technologies such as intravascular ultrasound. They're all fancy words, but what they basically enable us to do is to go beyond just the X-ray and to look within the artery itself. So in a sense, we can check what we do once we put the stent in to be sure that the stent is the right size, it's placed in the right place, there are no irregularities of the vessel before or after the stent, and really can optimize our results.
Have you had an opportunity to use this technology on younger patients, or is this something that normally takes place in older patients who have, certain types of cardiovascular disease?
It actually works very well in all patient types. In fact, the younger patients, one could argue, have the most to gain because you really want to make sure that the stent result that you get is lasting because they have a lot of years ahead of them. This is not a doom and gloom diagnosis where somebody has a heart attack and their life is over. As we've said, if you can get to the hospital early, we expect normal life expectancy, and that's why we're doing such efforts to educate during Heart Month. But if you use these types of technologies, our feeling is that we can actually prolong how effective that stent works and hopefully avoid missing areas that we would not otherwise have recognized if we were just using the traditional technology alone.
Where can our listeners go online and learn more about this technology?
There's several resources for them. The organization that I work with would do a lot of research is called the Cardiovascular Research Foundation, so that's www.crf.org. And then even just Google searches or YouTube searches on imaging technologies in the cardiac catheterization lab, such as optical coherence tomography or intravascular ultrasound, would actually be very, very useful. And they're quite good videos that one can see if you search on those items.
Well, Dr. Courtenay, thank you so much for talking with us today.
It was a real pleasure being on.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au.